Welcome to Live with Hillsdale Hospital. Today is Wednesday, November 20th, 2024, and we're here to keep all of you, our friends, our family, our patients, informed and up to date on all the happenings here at Hillsdale Hospital and healthcare in Hillsdale County. I'm J.J. Hodshire, President, Chief Executive Officer, excited to be here today as your host and joined in the studio by the none other, the one, the only, the most popular of all, because we get the highest ratings when you're on, is Randy Holland, Chief Infection Control Officer, Director of Ancillary Services and Special Projects, which you've been working on a lot. I may even quiz you about some of them. Yeah. Randy, it's great to have you in the studio again.
Well, thank you, Mr. Hodshire. It's finally nice to be invited to be on your show.
It's been, what, a year?
Probably,
yeah. So I lifted the year. The moratorium was, was on for a year because we got so many complaints.
It happens.
It did. But it's great to be back in the studio with you, Randy. A lot of things are happening.
A lot.
We're going to talk about some of the concerns. You're a registered nurse, but why don't you talk a little bit about your journey here, when you started, where you started? I think that progression really lends to your background as we talk about some very important things today.
So originally started here at Hillsdale in 2002.
Wow.
Following the tales of my wife, who started here in 2001. At that time, there was a program called the TAP program. Yep. So it was technically advanced personnel. Yep. So we were glorified CNAs. But we did a 9-month class that Hillsdale Hospital provided. We didn't get paid for taking the class, but we did our CNA, got licensed for CNA. We did, I think it was one course through the college to learn body structure and function, another course for medical terminology. We learned phlebotomy, and then we were required to become an EMT. So we actually did the EMT course through JCC.
I didn't realize you were a medic.
And then we were tested and EMT certified, and then we're allowed to, we could apply as a TAP personnel here at the hospital after we received our CNA license.
So let's back up. That's when the hospital sponsored the program.
Yep.
Did they pay you to go through it?
No.
Okay, so you did it on your own. If you didn't pass, then you didn't have a job, obviously.
Well, you could get hired after the CNA class part of it. If you didn't pass the rest of it, then you could work on the skilled nursing.
All right, very good. So you did that, and you spent how many years doing that type of work?
So I did that as a TAP for about 8 years before I decided to go to nursing school, and then went to Kellogg Community College, graduated in 2010 with my associates from Kellogg Community College. That same year is when I became the infection control nurse here at the hospital.
Yeah, that was fun.
Infection control since then, multiple different hats since 2010 in the journey. So
and education.
Then manager of ER.
Yeah.
While here. I did leave for a couple of years and did travel ER nursing. Yeah. So broadened my horizons and abilities as a nurse, I believe. Then been manager of environmental services.
Oh yeah, you've done it all, man.
But not many departments. So since when 2019, I started for my bachelor's through Siena. And then I was in my last 4 classes when COVID hit.
Yeah.
So finishing my last 4 classes for my bachelor's at the same time
that you're an infection control officer during
trying to figure out COVID when it all was going down.
Yeah.
And then
but you did.
I did. And then this last April, beginning of May, I completed my master's in health administration through University of Phoenix, trying to expand my knowledge, not just to be nursing, but more institutional and how the health system works as a whole.
System. Yeah. So a remarkable journey. And I think what's important to stress here, and as we talk about pathways for individuals to get into healthcare, did you ever dream that you would have a master's degree in healthcare and seated at a table that you are dealing with the things that you're dealing 24 years ago?
I never was
You were in a factory.
Interested in healthcare until my wife started.
Yeah.
And I started helping her study, and I was like, oh, that's kind of cool.
Yeah.
That kind of interests me, and it clicked. But before that, I worked in a factory for 8 years in Jonesville. Before that, I lived in Texas after graduating from high school here and worked at Kroger's.
Yeah.
The whole time that I was in Texas. So
I think the story is about the journey, and that journey is open to everyone. If you want to apply here at Hillsdale Hospital, you can start at a CNA level and become an administrator. You can become a nurse, a CRNA. There's a variety of things that you can become. And so we would encourage you, we usually do this at the end of our program, but I'm going to encourage you, look at our website, look at the job opportunities. Don't be afraid. Randy 22 years ago took the lead from what he knew in manufacturing, steps over, takes a pay cut to do that, and starts a career that has been very rewarding for you. So, part of your job, Randy, infection control it's significant work. It's employee health, it's community health, it's patient health. It's a lot.
Yeah.
And today I want to talk a little bit about, what all of that means in our community, because we're at a very critical spot right now in our seasons.
Right.
We're talking about flu and a lot of things that are going to be happening that have already started. We're starting to see a little bit of that. This is the time of year that picks up. Before we do that, I do want to ask you, I think it was about a decade ago, I was approached by Red Cross, and they had asked us to do a blood drive. And there was some reason we couldn't in the facility. I think it was space.
It was
a requirement because you have to have so much space.
860 square feet.
860. We had nothing open at that time, and we really never ventured down that road. But we've always said ever since then, we need blood, we need blood, we need blood. But what have we done to really promote that? So you have something to share with our community.
So been working with Red Cross. So I started looking into this in the summer because there is such a large need for blood. And as director of ancillary services, one of the departments that administratively I'm over is the lab. So I hear a lot about the inventory of the blood and blood shortage and how difficult it is to get this type or that type.
Yeah.
I mean, it's very not like it used to be. So I started working with Red Cross to try to figure out how we could sponsor a blood drive in our community. There are other blood drives in the community, but I feel like as a hospital, we should be, sponsoring a blood drive as well. So figured out the space. United Brethren Church has graciously allowed us to have their room to do a blood drive on December 17th.
Nice. Talk to us a little bit about that. What is it?
So it will be December 17th from 10 to 4. You can go on, and you should go on and register, and I'll read it so I get it right. redcrossblood.org whatever that is, give.com. And then they'll ask you to type in your zip code, and then you just fill in your information from there. So we will have our staff, a few that have volunteered, that will be there just mingling, giving snacks, making sure people are all right. Red Cross brings their own staff that do all of the blood draw. Like, this is their job.
Yeah.
So they do all the IV starts. They do all the actual taking of the blood. So,
So I understand.
So we will be there just
You're making the snacks personally?
No, they bring all of them.
Oh, I thought you were doing
No, I got all that.
You got out of that?
Yeah.
But you're doing little cheesecakes.
No,
I guess
I got
my
that.
information was
Yeah, it was wrong.
So listen, this is your opportunity to support Hillsdale Hospital, support your community, and fellow mankind, because as individuals come in, either in trauma or on the floor that we need blood and we need it quickly, whether it's in the OR, we really count on having the blood bank full.
Right.
And I believe it has been at least 6 years that we continuously hear the blood banks are in shortage.
Correct.
And shortage and shortage. And so we'd like to fill those up. So if you're in the giving mood this year, give your blood. And that's very important to sustain patients and individuals that come in a trauma situation, car accident, or major events. Please give that some consideration. All right, Randy, let's transition conversation into seasonal issues. It's getting cold out. You can sing that song, Baby, It's Cold Outside?
Can you tell me I can?
Okay, please don't. And so a lot happens between now and spring as it relates to illness. Now, historically, the hospital would come out with some announcements,
right,
and we would say maybe like our skilled nursing is going to be shut down for visitors, or that the obstetrics is on lockdown for visitors. We do that because you're trying to prevent the spread of disease and those things. So start with just really, winter's upon us soon. Talk to us about, what we're seeing right now. Are we seeing the increase? And
this is a very strange year.
Yeah.
So, last year all the news was the trifecta, because the RSV, the COVID, the flu, RSV, all of that, and it's going to be horrible. This year, it's not so much trifecta that's being said anything about. A lot of what I see, and I'm sure there's rapid testing that's being done, at home or in physicians' offices. But what comes through the lab, I have not seen a considerable amount of COVID positive, RSV positive, influenza positive, like lower than what I've historically seen at this point in the season. Mm-hmm. What seems to be going around, and we did get a alert from the health department, I don't know, a month or so ago. It's a mycoplasma pneumoniae, which is a virus, and it's just hanging on with people. Like, they get it, they feel horrible for a week, then they feel better for a couple of weeks, then they feel horrible again, and it's just, then it turns into full-blown pneumonia, and they end up having to get steroids.
Do
and
all
antibiotics.
of them turn into full-blown? Because I've known someone who's been like this for a couple months.
Right. I can't say all of them.
Right.
So there are a sizable amount that I've seen that has had that happen.
Right. So then, of course, they get on steroids and go through that regimen. Recommendation to the community then, when you're feeling this way, don't try to tough it out. Should they go see primary care? Come to the ER? What are your recommendations?
So just how you feel. Like, just because you feel bad initially does not mean that you need an antibiotic.
Right.
So kind of another for this week, and it was, I think, in our script so this week is Antibiotic Resistance Awareness Week. Go Purple is how CDC has it. And it's just that there are so many people that always insist that no matter what's going on, they get an antibiotic.
Yep.
If it's a virus, an antibiotic is not going to help you at all.
No.
So the more you take the antibiotics, your body becomes resistant to it. So
it is, by way, the number one complaint that I often get at this time of year from
everybody wants an antibiotic.
They're angry that the doctors do not prescribe the antibiotic. And we try to educate and say, but you're not going to, you don't need that. And talk about
it's a mindset.
But what does the resistance talk about? What could potentially happen?
So once you build the resistance, when you actually have something that you need an antibiotic for, just the normal antibiotics are not going to help you. You're going to go to what we call the high power, the big guns, and they make you feel really bad.
Yeah.
Like, they can do kidney damage and liver damage, and you just are not feeling the greatest because they are so strong. So
the old adage, tough out a cold, or try to beat it. There is some merit to that.
There is them,
right?
And there are a lot of, and it doesn't take it away, and it's not going to work for everyone. But there are a lot of homeopathic, you know what I mean, like things that people have done that helps them. So I say you have to know your body. And don't get to a point where you have to come to the ER. my first thing would be go see your primary care
Right.
physician if you're feeling bad
It's
and
gonna be
you're
a lot
running
cheaper.
a fever, and it is.
And you're going
all
to
of
get it probably
that.
quicker, because when you come to the ER, you're in a waiting line
Correct.
based on acuity, what's wrong. So if you have someone ahead of you that's having a heart attack,
Right.
it's going to be a long time before you get seen.
And it's just the awareness of not everything initially needs an antibiotic. At some point, maybe it does. But if you have a virus, you get the antibiotic, it's not going to change the course of the virus. So you're not going to get over the virus quicker.
Right.
Because you had an antibiotic.
Just because you had it. Yeah. All right, let's transition and talk a little bit about COVID-19 itself. What's COVID numbers looking like for us at the start of the season right now? I'm not seeing a lot of it.
Very low.
Very low. We're not getting reports from CDC or, of
No.
a major.
Nothing like it has been
in the past.
Historically.
Yeah.
With this season, supposedly the vaccine that just came out this fall is now COVID is transitioning to be annual vaccination like the flu.
Okay. So speaking of vaccination, my understanding, explain to the public, you need your shingles, you need your, a certain age, you need your flu, and you need your COVID. You can't necessarily get those all, the same day.
Well,
so talk to us about.
There are some that will say you can get, as long as you get them all on the same day, you can. I do not find that to be
the most
helpful for you.
Yeah.
Because your body needs to build an immunity for the vaccination that you're giving.
Yeah.
Like help build up that immunity to that foreign object that's going to keep you from getting it. So when you have all of them, I just think personally feel like it's an overload.
Yeah.
And if you have a reaction, how do you know which one you're having a reaction to?
Correct.
So generally, if you don't get them all the same day, usually 2 weeks apart.
2 weeks apart. So where can someone get their vaccinations?
Any of the Walgreens, Walmart.
Right. Primary
Some
care.
physicians' offices have them, not everybody.
Health department? Are they giving any vaccinations? None? All right,
well, they have some, but your insurance is going to be billed, and the day of free is done.
Okay. So let's talk about, all right, someone gets their vaccinations and they're doing what they need to do to try to stay healthy this winter. What other steps beyond vaccination can they take to remain healthy? There's ample opportunity for them, obviously, to be out. If they're not feeling well, they probably shouldn't go out. So talk to us about what are just the common, things that people do to
I think that's the
healthy.
problem, is that common sense is kind of gone by the wayside. So if you really feel bad, you're coughing, you're running a fever. If you're running a fever, you're contagious, regardless of what you have. Just know you're contagious. Unless you're running a fever for a medical reason.
Yeah.
Some people run fevers
medically.
Wash your hands when you're out in public. Try not to touch your face, because you're pushing carts around or opening doors, getting casts.
Yeah.
And then people have touched that prior to you.
Right.
Touch your face. That's going to be the portal of entry, as we say in orientation.
Yeah. So wash down your carts if there's little wipes or no.
Everybody does. I think it's just second nature now after COVID, but just be mindful of how often you touch your face.
Yeah.
Because that's really where it's all coming in at.
Right. All right. So simple tips, when you're not feeling well, don't go out into major events, because you could be that super spreader event. And, if you're not feeling well and you're under the weather, people understand in today's times, especially employers, that if you're truly sick, they don't want you at work. We learned that during COVID, that, that spread of anything, flu, COVID, whatever it is, you can contain that by staying home. So that's number one. Vaccinations, obviously, that's very important. But Randy, let's talk a little bit about what do we do at Hillsdale Hospital to prevent infections? What do we do to prevent the spread of disease here at Hillsdale? What do patients do?
So cleaning is the first line. making sure, again, that when a person has invasive devices like a IV or a central line or a Foley, that we're cleaning those properly. We're taking proper care of those. Surgery has pre-screening questions. They're also instructed, if you're not feeling well the day of surgery, you need to call and reschedule with us because we don't want you here sick and making our other pre-op patients sick. We strongly encourage our employees to be vaccinated. If they're sick, to stay home. That's pretty much.
Sure. So we, at this time of year, historically, if the flu and the COVID are high, which we're not experiencing right now, but let's say it turns that way in the next 30 to 45 days, there's also precautions you put in place to safeguard our patients, especially in the obstetrics and skilled nursing. How does that happen? Why are we doing that?
So skilled nursing is a beast of its own, I'll say. There's a lot now that really limits us from shutting a skilled nursing down at this time. That could change in 6 months. Regulations for them can change all the time. But the policy that I instituted is looking at the community, employee, and inpatient to make the decision. So we have to be at this percentage of our community testing positive for flu, COVID, RSV, along with this percentage of our employees have been sick in the last 30 days, as well as this percentage of our patients in-house right now are sick with this illness, and that's why they were admitted. At that time, then we go to mandatory masking for employees, no matter your vaccination status. It's just across the board.
We've been doing that pre-COVID. This has been something we've done for decades.
With OB, you have to realize that our largest population of concern for catching anything are newborns, very young children, and are old. So our old, we're a lot regulated. We kind of do it, but we're regulated more by government and state as to what we can implement as far as their rights there. The newborns can't speak for themselves. You know, there's not regulations out there for newborns. So we take that on ourselves to protect the newborns. So we shut down OB. We limit the number of visitors to limit the exposure the baby has while they're with us to catch something from somebody else that's not their family or even their family.
So we do that with a purpose of shielding and protecting the most vulnerable among us, which is our seniors. And consider this, you know, pre-COVID, we weren't talking a lot about all the times that patients are dying in skilled nursing facilities across the country from the flu. The flu takes out just as many. So that's why we implement those protocols. So if you're going to make that announcement, you do that publicly. Is there postings?
There is the units. It will have posted on the units themselves. And then we do a press release. We always, or I have always, you know, it's not just a decision. I say, okay, this meets all the criteria and we're going to do this. I also talk with the chief of staff for OB. I talk for chief of staff for medicine. You know, there's more involved than just me. And I mean, usually they just say, okay, we agree. You know what I mean? There's not.
Well, because they understand the seriousness.
Yeah.
So before we ask if there are any questions from our audience today, Randy, I want to talk about your favorite subject.
Me?
You.
Awesome.
So is this?
I have learned a couple dances.
No, I don't want to hear about
the
that.
last year.
But is it No
I have
Shave
a turkey.
November? Is it No Shave November?
It is No Shave November.
Is that what's going on?
For male health awareness.
All right.
For male cancer for men and other,
because
prostate issues, things that are where they have breast cancer awareness month
Yes,
and all that
it's
kind
male
of stuff.
awareness month. So I did have someone want to complain about you the other day, and they said the guy that looks like Sean Connery. You do kind of look like him.
Well, I get
A little
that.
Who else?
Somebody from The Walking Dead. I never watched Walking Dead, but
No.
somebody that carried a bat with nails in it.
I wouldn't say that. I would rather go with Sean Connery.
I mean,
just saying, for a friend, Sean Connery better than Walking Dead.
But he's old.
So now tell our listeners, because they were most interested a year ago about the goat you had. So what are animals are on the farm this year, Randy?
It's dwindled so much.
Did you have a turkey?
I do have a turkey.
Is that for Thanksgiving?
No, she's been pardoned, so we're going to have an official ceremony, and it might be on my TT. I can't say that, but
okay. All right, so you're going to do that.
I'm going to do a whole pardon.
You are. Who pardons the turkey?
Sean Connery.
Okay, you're not going to have a minister out there or anything.
Well, I'm
you are
minister
also
as well.
Too. I forgot about that.
I won't say that.
Mail-in license.
Yeah,
I forgot about that. Hey, it's all legit.
It's legit.
Yeah, ask Paul. Yeah, it's all legit. All right. So you got the turkey.
Got the turkey. She's my biggest friend right now.
All right.
I have
friend, but still.
I have a dwarf goat, so she's a little goat, blind in one eye.
Can you say that?
A Nigerian dwarf. That's what they're called.
Okay, just making sure. And she's blind in one eye?
Yeah.
All right, so you got.
I like special needs.
So you just want to take care of the animals.
Yeah.
Okay.
And then I have two other goats and a sheep.
So I think on that
there's chickens at the farm.
I think there's a question, isn't there, Kirsten? All right.
So for the blood drive, do community members need to have their blood type tested before donation?
No, Red Cross will do all that at the blood drive. They have just a simple little card, and it takes just a matter of minutes.
Any other questions, Kirsten? All right. So one question was about the blood type, and then you can go the day of the event for that. Randy, it's been great to have you.
We didn't go over all the other.
We're not going to go over. Yeah, we'll do that.
So we're doing another also exciting.
All right.
So it's
ahead.
over when I think it's
exactly.
over, sir. Okay. Recently, Kirsten, poor thing.
I know. Recently,
I have taken on ancillary under my administrative umbrella. So that includes gift shop, volunteers as such. We are championing a coat, hat, boots, mitten drive for the community. Any size, adults need them. We have a very poor, it's not just kids.
Okay, I had heard that.
We have a very poor community.
So it's
if you really get out there, there's, if I haven't been over there in a while, but if there could, the tent city could still, you know what, there are people that need it regardless of the age. So any items that are new that you would like to donate for winter apparel, bring it into the gift shop. There'll be a box in there. And if you can't find anything in the community, you can just stop in the gift shop and buy it there and then put it in the box.
Okay, did not know that.
So
awesome.
That was my other thing going on for the community.
Warm coats, mittens, it's important, and we give back to the community that way. I do know that the hospital is making a large contribution of those things as well to give to the shelters. And so if you're in a generous mood, there's a couple opportunities. Number one, blood that you can give, or number two, you can warm hands and give to our drive in the actual gift shop. They actually just bring it there.
Yep. There'll be a box right outside the door.
All right. During obviously hours in which they're open. All right. Well, Randy, it's been a great pleasure to have you. It'll be another year definitely before we see you back here.
Awesome.
But we're very hopeful that
give me time to get working on my dude.
Yes, please. I'm very hopeful that it remains quiet in the areas of COVID, flu, and that we don't see the onslaught. So
thanks.
I know I'm not supposed to say that word, but I did. All right. To close, we want to thank you, our listener, our community, our friend, for using Hillsdale Hospital as your place in which you receive your care. It is so important. The sustainability of this hospital, I've said it a million times, is totally contingent upon you using these services. So I want to thank you for those that use them. For those of you that are in question about what services we have, you can go right to our website, hillsdalehospital.com, and there you'll find other opportunities to work here, start as Randy did 22 years ago, in a job taking care of patients at the entry level, and have a great opportunity for Hillsdale Hospital to sponsor your education, send you to a training or a specification of a school that you want related to healthcare, of course, and make this your home. So you can look at the jobs that are available under the career tab at hillsdalehospital.com. I think last time I checked, we had like 32 openings, plenty of opportunities for you to work here. If you're looking for ways to volunteer, Randy is now supervising that division of our hospital, but there you can become an auxiliary member. You can just come in and volunteer. Great opportunities for you to do that if you don't want employment. But we are in need of volunteers as well, individuals to help us in various parts of the hospital with patients, throughput, as well as just volunteering, let's say in areas like the gift shop.
Correct.
Great opportunities for you to connect with the community, the public, the staff, patients, and their families. So there's an opportunity for you to do that as well. Every week on WCSR, we will talk about these things such as blood drives and opportunities to give our community clothing. And we do that once a week on 92.1 every Friday. And then we're also on another radio station on Saturday, Buzz 102.5. Great opportunities for you to listen to what's happening here in this community. Every week, we bring you a live event like this. Next week, we'll be back again. And then opportunity for you to listen to a national healthcare podcast, Rural Health Rising. So wherever you get your podcast, subscribe to Rural Health Rising. We'd love for you to listen to what we're trying to achieve in rural health. We're trying to identify and lift up the hard work of rural hospitals across this country. We are the economic backbone of our community. Hospitals that are rural, usually the first, second, maybe even the third largest employer in those respective communities, but taking care of the patient so they do not have to travel. In communities where there's no transportation, public transportation, we are the only source of healthcare for them. So look at us in a different light, like what can I get done at Hillsdale? Not what can I get done elsewhere. And so I would just encourage you as our friends, as our family, to continue using Hillsdale Hospital as that place for you to get your care. And I look forward to seeing you back here again next Wednesday with an exciting guest. And until then, stay safe, stay healthy, and stay Hillsdale strong when you use Hillsdale first. Thanks for joining us.